You never quite know the power of one decision until long after it's been decided. The smiles that surround you, the ones you empower and trust, the moments that hold steady in your heart. They all start where? For John DiMattio, in human services, in helping others, in giving back to a community while never loudly boasting about being in the front. This story, and all that comes with it, starts with a yes. Yes to the work. Yes to the mission. Yes to early mornings, late nights, and working hard for people who never had it easy. He built a life. He found love, raised a child, helped people rewrite their stories, all while quietly writing his own. One decision was all it took. And as we know, the choice to work in human services doesn't just change you.
It becomes part of your DNA. I grew up in a sort of blue-collar, I'll call it gray-collar neighborhood. Not everybody was blue-collar, not everybody was white-collar. It was just kind of regular people.
As a child, he was not a difficult child to raise. He got along with everybody, talked easy, could carry on as he was always amazing, a kindergartner, and he could talk to adults with no problem at all.
Growing up, I was very interested in adventure. So wandering away from home long before cell phones or tracking your kids with GPS or any of those kinds of things. If you do talk to my mother, she may tell you stories about me wandering away for hours at a time and not coming home.
He just did what he wanted to do when, I was frequently, looking for him. John, where are you? Where are you? We didn't have cell phones, things like that. Walking the neighborhood looking for him. There were a lot of children in our neighborhood.
There was a pear throwing incident that she likes to share, that a group of boys were throwing kind of ripe pears at a neighbor's house, and John was the youngest in the group, and somebody broke a window, and everybody ran, and John was the last one sane, so that was, he caught it. He caught it for that.
I don't want to talk about the college years.
During my college years, I worked at St. Vincent's as a housekeeper on third shift, which was an eye-opening experience. And before my senior year at college, there was a freeze in hiring. The economy at that time was not wonderful, so people didn't have a lot of jobs out there. So I came back from school before my senior year of college, didn't have anything to do. Ended up, my dad knew someone who was in the Army Reserves with him, who had just gotten out of the Army and said he was working at the Barber Center. And so I had never worked with anybody with a disability. I didn't even know anyone with a disability. And my dad said, well, they're hiring down there, and Greg said, sure.
I can remember one of the first days that he came into work, and he was very nicely dressed. He was very tidy. And the girls and I were laughing because some of the guys, the nature of the job, you're going to get food on you maybe, you're going to assist with showers, you're doing this and that. Well, the clothing attire, some of the guys were just bummy. And here comes John, all tall and handsome, nice clothes on, and all the girls thought he was totally dreamy. And that was the first impression of John.
And I worked in a place where they had a 43-bed facility, so I'll call it a mini institution, at least that's what I would call it now. Tried to make it as home-like as possible. It was more like a college dorm, but it was co-ed. There were rooms that were shared, and we did everything to support people through their lives who lived there. And I really, really enjoyed that. And it took the next 14 years of my life moving through that. So it was pretty interesting. And did a lot of different jobs there. And obviously it's stuck because I'm still doing this, but During that time, I met a lot of people, a lot of families, a lot of individuals with disabilities. That really helps you develop as a person. So that part was pretty interesting. I'm getting emotional. I'm sorry about that. It's almost too hard to comprehend that what seems like an arbitrary decision changes your entire existence. And that was one for me. It totally changed who I was, how I was, the direction I was probably going. Could I be selling you a car or a suit or a pair of shoes right now? You bet. I don't think that was my destiny, and perhaps this was my destiny. I don't know. The Lord put you in places where you're supposed to be. If you talk to people about how we operate here, and maybe I'll make this a little less about me, but more about our system, because I feel like in so many ways, the people who work here care. You're doing this because you like to see the outcomes of things. And, you know, I will tell you this, and I just say this to people all the time. People ask you, like, what's the favorite thing that you do in your job? And it hasn't changed in all these years. I like solving problems. I like fixing things. I like trying to make things better than they were before you started. And you get to do a lot of that in this system.
He's excellent in the way he treats people and the way he gathers information and the way he listens. And that kind of leadership throughout human services spreads then. He sets the tone for the way services will be delivered and received throughout the community.
He's worked direct care years ago. He's worked in the ID system, he's worked in the mental health system, he's worked in the drug and alcohol system. Any system that he hasn't actually worked in, he's worked extremely hard to learn about that system, even though he wasn't necessarily a direct care staff in that system. So he brings that knowledge base that I've not seen in anybody else that I've worked with.
I think it helps us to be incredibly transformative, right? Because he understands it from a provider level, from a program level. The fact that he has that lens from what this means of taking policy or initiatives and transforming them to actual service delivery. So he understands that. He certainly understands the diversity of different services that are being provided, from his work, again, in a residential setting, to looking at individuals with disabilities, to working in drug and alcohol, to having to manage and support an entire continuum of human services. So it has been, I think, very helpful over the past, I shouldn't say few years, many, many years, and even in his role of a large administrative role, to be able to be impactful directly to providers, but what that means to our community as a whole has been transformative.
And, if you ask me at some point, sort of where have we gone or what are we doing? Trying to come up with a unified human services system is what I've been trying to do for the past 11-ish or more years now, to really bring us closer together as much as we can. There's a zillion different funders and funding streams and rules that come along with all of those dollars. But that's been the goal.
Children's services, so many of those things are far-reaching, and he's able to look at that with how shall I say, really reasonable perspective, not just how he feels or how his life has been, but look at those people's lives and what their lives are like.
He will take time to understand you, to understand situations, and he truly cares about doing the right thing, whether it's an internal circumstance or a system-wide community project.
John is one of those people, he's laid back, he's quiet, but he is thinking. He's always looking for ways to be impactful. He has great ideas. He understands systems and he understands needs, and he's always willing to help. And so I always think of, when you, in that moment, that's what I think of, is that he's a quiet spirit, but impactful and always looking to have major impact.
He's involved in different committees across the state. He's down there and saying, what can we do? What are you doing? Maybe we can pull that in here. That's how he works and thinks. So he's always been a team player. It's never been just about John. So he's just special that way. He's special.
I think John has, from his start at St. Vincent's, through his time here, through the time of the county, he's consistent. He's always the same. He's not different. He's not looking for the limelight. He's trying to get services to the people that need it.
I commend the work that he's given, his life to, in terms of his professional life, to our community, and the work that he's done and opportunities that I think organizations have had and really transformed that. He's a great person, and that's come through in the work that he's done.
I really think he's encouraged people to stay true to the reason they got into the field of human services, to remain grounded and humble and dedicated to the people that we're really working for, the most vulnerable in the community. I think that his dedication to the true purpose of the human services field is what will be a lasting impression.